I am Dr. Girish Parmar. I'm a consultant endocrinologist at Nanavati Hospital. And on the occasion of World Thyroid Day, I'm going to talk to you about thyroid disorders. Thyroid is nothing but a butterfly-shaped gland which is located in front of your windpipe below the Adam's apple over here. And the job of this gland is to take the iodine from food and convert it into two hormones called T3 and T4. So iodine is the raw material, thyroid gland is the factory, and the end product is T3, T4. These two hormones are responsible for the body metabolism, body heat, and body energy. Now when we talk of thyroid gland disorders, the disorders can be divided broadly into two aspects. One is disorders related to the appearance of the thyroid gland, that is lumps in the thyroid gland, what we commonly call it as nodules. And the second disorders, which are more common, is pertaining to the functioning of the gland. When I say functioning, as I mentioned earlier, the functioning of the gland is to produce two hormones T3 and T4. Therefore, you can have two thyroid disorders where thyroid is working less, which is commonly called as hypothyroidism, or your thyroid gland is working more, or an overactive gland called as hyperthyroidism. If we look at overall thyroid disorders, hypothyroidism is much more common as compared to hyperthyroidism, and thyroid nodules occur in about 10% of individuals. If you do a sonography, then the incidence of thyroid nodules can go up to 40%. So I'm going to discuss the most common thyroid disorder, that is hypothyroidism, where the thyroid gland is working less. Obviously, if the gland is working less, then the production will be less, so the blood levels of T3, T4 will be less. As I said, T3, T4 are hormones which are responsible for body metabolism, body heat, and body energy. And in hypothyroidism, when the gland is working less, the production of T3, T4 will definitely be less, and therefore the body metabolism, body heat, body energy reduces. Everything in the body slows down. So people complain of fatigue, lethargic, depressed, they don't sweat, so skin becomes dry, intestines move slowly, so people get constipated, heart beats slowly, blood pressure goes up, they tend to lose a lot of hair. Since the body heat is less, whatever they eat is not burnt, so the weight goes up. Since the body heat is less, they cannot withstand air condition for a long time, menses become irregular, so on and so forth. So these things happen when the levels of T3, T4 are reducing. When the levels of T3, T4 are reducing in the blood, the same blood goes to the brain, and the brain is the one which controls the entire body. So the brain senses that the levels of T3, T4 are low. So obviously the brain makes an attempt to stimulate this thyroid gland by sending another hormone called as TSH. TSH stands for thyroid stimulating hormone. So when T3, T4 levels are low, the TSH goes up. Now what do we do? Why is this thyroid gland functioning less? About 3 decades back, the most common cause of hypothyroidism was iodine deficiency. But nowadays, the most common cause is autoimmunity, where your own immune system destroys your own thyroid gland and thereby reduces the production of T3, T4. If you notice, autoimmune disorders are quite common because of increasing usage of pesticides, increasing usage of plastics, and so on. There are a lot of endocrine disruptors which cause hypothyroidism. Treatment of hypothyroidism is quite simple. Since your thyroid gland is not able to produce adequate T3, T4 and your body needs T3, T4, you take it from outside. What we give from outside is nothing but a pure hormone T4, which in the body gets converted into T3, and it raises the levels of T3, T4. Your metabolism comes back to normal, and if the dose is appropriate, brain says the levels are now normal, I don't need to stimulate, and the TSH starts coming down.